Ladies and gentlemen, welcome back to our fourth lecture in the series of philosophy and leadership of occupational health and safety. Again, our e-learning materials are available on the e-learning platform, and James has been able to upload everything. And as I promised earlier on, we're going to discuss issues that relate to the nature of work and relating concepts of occupational health and safety and well-being to the concept of the nature of work. So I went through all those definitions, and I did discuss issues that have brought about changes at the workplace and so forth. And now I want to take you through the last lecture in this series. So our last lecture in this first topic is related to the social determinants of health, safety, and well-being. Please note that in this lecture, we are discussing social determinants. I know our subject is on health, safety, and well-being, but there are those social issues that do impact on safety, health, and well-being. So, as I said earlier on, and I continue to repeat these things because I want you to be grounded in these concepts. Our interest is in understanding the philosophy and leadership of occupational health. So we see that new forms of work organization and employment have to be considered within the wider picture of employment and working conditions across the world. There is no particular section of the world that is excluded in this endeavor that we are talking about, especially if you are dealing with safety, health, and well-being. We know that labor markets and social policies determine employment conditions, and they include things like the informal jobs or the precarious nature of the jobs. These laws deal with issues of child labor or slavery. They deal with the issues of insecurity. They deal with the issues of low-paid jobs or working in hazardous conditions. Because we know all these certainly have health consequences. So you've got the legal aspects, and these relate to what we call labor markets and the social policies that are developed by nations. They deal with those issues of health, safety, and well-being. However, there are other issues which are not considered. And these are the social issues, the social determinants. But before we go to those social determinants and discuss them in detail, I want to bring to your attention the International Labour Organization report that summarizes the potential impact of financial crisis on organizations and the health and safety of employees. Now, let me just articulate these things briefly, and possibly you'll pick what the report is talking about. This is the International Labour Organization report that has articulated these issues. Now, one of the issues they have discussed is the issue of the financial crisis. Now, financial crisis has brought about the following issues, like cutting costs. And the first thing that they think about in an organization is the employee. Cutting costs to employers means laying off staff. And this, remember, has psychological consequences, attendant psychological consequences. Then, the other issue is decreased public spending, decreased production, cutting jobs. And this is really downsizing. And of course, shutting down of some facilities. And that is really a financial crisis, bringing about those particular changes. And at the end of the day, who is affected? It is the employee that is in the boxing ring. And the employee certainly is engaging an individual that is very powerful, is engaging the employer who is very powerful. So in terms of bargaining power, the bargaining power of the employer is far above the bargaining power of the employee, especially in an environment where you have high unemployment rates. The second aspect documented by the International Labour Organization is what we call the organizational changes. Now, these organizational changes bring about what we call the reprioritizing of resources, the reduction of non-productive functions, cutting occupational safety and health resources. You have now more part-time, more temporary workers, more outsourcing, more subcontracting, dismissing workers. And these are organizational changes that come with downsizing. And I've already articulated those issues. The third element captured by the International Labour Organization report is the compromise in occupational safety and health measures. Certainly, when you have changes at the global environment impacting on organizations, then there will be a compromise in occupational safety and health measures. So, you will certainly lose occupational safety and health professionals in enterprises. Then you have a decline in occupational safety and health measures, procedures, programs. Then you have the aggravated organizational safety and health conditions in informal jobs. And then you have hazards from overwork, and others will be certainly given more jobs to perform as a result of merging certain jobs. And then you have longer working hours for employees, and the psychosocial stress from sudden unemployment. So those are issues which are articulated by the International Labour Organization. Ladies and gentlemen, increase in workplace accidents, increase in diseases, increase in fatalities, and increase in ill health from unemployment will be the order of the day. And that's what the International Labour Organization report of 2013 says. And if you look at the most recent one, of course, there are so many other new things that have come in. Allow me, at this material time, to move into what we call the new and emerging risks at work. So, ladies and gentlemen, an emerging occupational safety and health risk is often defined as any occupational risk that is both new and increasing. There are those particular things that you can always anticipate to happen, and you can plan for them. But when we talk about emerging risks at work, emerging risks that relate to occupational safety and health relates to any occupational risk that is both new and increasing. Now, new in this case means that the risk was previously unknown and is caused by new processes, new technologies, new types of workplaces, or social organizational change. A long-standing issue is newly considered to be a risk due to changes in social or public perceptions. So that's why we talk about new risks. A risk is increasing if the number of hazards leading to the risk of is growing. It is increasing if the number of hazards leading to that risk is growing. And that's why at the workplace, we are supposed to manage these issues very well. And I'm going to articulate 3 emerging risks. Now, the first category is what we call emerging physical risks. Right? The second one is what I'll call emerging psychosocial risks. And the third one is what I consider emerging dangerous substances due to technological innovations. So why don't I then start with emerging physical risks? So these emerging physical risks relate to physical inactivity, and they are associated with increased health risks, such as the coronary heart disease. They include things like type 2 diabetes, and certain types of cancers, and psychological disorders like depression, anxiety, and so forth. Now, these are considered as emerging physical risks. Now, the employers do not think about these things, that once you have employees stuck and glued in their offices and probably eating and not moving around and exercising, they will certainly suffer from what we have just called emerging physical risks. And of course, another important result of inactivity, because these relate to inactivity, is obesity. And obesity can lead to several adverse health effects, such as back pain, high blood pressure, cardiovascular disorders, diabetes, etc., etc. So those are issues that are very important. So such disorders, like the ones that I've just talked about, they may lead to sick leave. So you may find that at any given time, many employees are applying for sick leave. And sometimes you get what we call work disability. So the established health risks associated with this sedentary work are premature death in general, type 2 diabetes, etc., etc., etc. So again, I want you to think about those issues that we have talked about. I will not really go into details of those things. But 2, let's go to emerging psychosocial risks. Now, these psychosocial risks include job insecurity. And this has been discussed earlier, if you recall our previous lectures. And it's an important stressor resulting in reduced well-being. And that is psychological distress, anxiety, depression, burnout, reduced job satisfaction, etc., etc. And you may find at any given time employees withdrawing from the work or workplace or from activities. So those are aspects, and I will not really go into detail of those things because you understand exactly what we mean by those issues. But certainly they do impact on an individual. And today, this added element of ICT is very dangerous. The widespread use of information and communication technology has led to work intensification. As you can see, developments in technology, in the use of technology, in terms of mechanization, in terms of automation, in terms of computerization, has led to the substitution of human activity by machines. And you know that very well. On the other hand, the use of computers and smartphones with internet access provides easy access to all kinds of information, but may also lead to the expectation from colleagues, supervisors, and employers, and the clients, by the way, that you are available all the time. And these fellows can call anytime, they can send messages, SMS messages, WhatsApp messages, email messages, etc., etc. So ICT work may then lead to stress symptoms due to excessive working hours, workload, and increasing complexity of tasks or isolation in the home workers. So we need to be very careful about that. Lastly, let me introduce the concept of emerging dangerous substances. So in this category, I'll talk about nanotechnology, specifically speaking. Nanotechnology has been defined as the design, characterization, production, and application of structures, devices, and systems by controlling shape and size of nanometer scale. And all these certainly have unique properties that improve the performance of many products. But at the end of the day, these things do have an impact on the employees of individuals, employees of companies, employees in organizations. Nanomaterials have application in many industrial sectors. And currently, the main areas are materials and manufacturing industry, including automotive, construction, and chemical industry, electronics, ICT, name it. All these sectors have these things. So anyway, let me end there by probably, before I conclude, I think I should briefly talk about the risk management paradigm, which I think is quite important for you to understand the philosophy and the leadership of occupational health and safety. You need to think about risk management paradigm. Beck, 1992, defined a risk society as a systematic way of dealing with hazards and insecurities induced and introduced by modernization itself. Remember, we are dealing with the risk management paradigm that relates to occupational health and safety. Now, Anthony Giddens, 1990, also defined a risk society as a society that is increasingly preoccupied with the future. And of course, this preoccupation of the future generates the notion of risk. So again, Giddens, 1999, defined two types of risks as external risks, for example, natural disasters. And you can have these, by the way. The natural disasters are all over the place. We hear about them every now and then. And manufactured risks, for example, those derived from industrial processes. Some of us work in industries, in factories. But even those who work in the service sector, like education, and you are still using chalk, you don't know the amount of chalk you inhale and the effect that chalk has on your health, safety, and well-being. So we need to come up with a risk management paradigm. And unless you understand risk very well, it becomes very difficult for you to think about that. So what does that mean? It means that we need to assess risks to be carried out prior to making an intervention. So understand the risks associated with the job that you are performing. And that assessment should identify hazards, should identify all affected by the hazards and how they are affected, and evaluate the risks and identify and prioritize appropriate control measures. And in such a situation, you need holistic models of dealing with risk at the workplace. So that takes us to the development of holistic models. So the starting point in the development of holistic models of health, safety, and well-being is the recognition that safety and health are different to well-being. I've already said that. We defined health, we defined safety, and we defined well-being. If you recall, in well-being, we had concepts like happiness at work. We had also issues that related to spiritual well-being of employees. That is not necessarily health, but for the individual to exercise and enjoy well-being, that individual must be healthy. As discussed at the beginning of this lecture, well-being refers to a good or satisfactory condition of existence, a state characterized by health, a state characterized by happiness, and a state characterized by prosperity. In particular, three key concepts have been discussed as relevant to well-being: happiness, quality of life, and resilience. I talked about resilience. Resilience is the ability to bounce back in face of adversities. Now, some employees are not resilient enough to bounce back to the original states after going through stressful conditions. And therefore, they end up suffering from a number of related ailments at the workplace. Now, Laird 2005 defined happiness as feeling good. Its inverse is feeling bad and wishing for a different experience. Now, factors that affect our levels of happiness, they include, among others, family relationships, for instance, our financial situation, the work, community and friends, health, personal freedom, and personal value. Now, quality of life overlaps with the contemporary interpretations of happiness. Quality of life is a subjective state that encompasses physical, psychological, and social functioning. Now, a defining feature of quality of life is its basis on the perceived gap between actual and desired living standards. So these are all important aspects for the employee, and that's why the issue of resilience becomes very important. Now, ladies and gentlemen, to promote health, safety, and well-being holistically, there needs to be synergy and integration among the various perspectives. And this is a job that cannot be achieved without the employer's involvement, without the commitment of organizations. To achieve this, these perspectives need to be aligned considering current knowledge and existing needs. We need to develop capabilities at the workplace and mainstream strategic policies and practices that can guide our operations. So it's very important for us to consider all those things in occupational health and safety. Ladies and gentlemen, we are coming to the end of this lecture. And since we are coming to the end of this lecture, I would like to conclude as follows. I would like to conclude our lecture. Ladies and gentlemen, this lecture has provided an overview of the current state of the art in relation to health, safety, and well-being in the workplace as regards to key determinants. That is an aspect that we have achieved. The second achievement, ladies and gentlemen, regards to the changing nature of work and the new characteristics of the workplace. The new characteristics of the workforce, new challenges in the merging workplace. And I'm sure you remember those things because we discussed them. New challenges are emerging certainly in the workplace, and as employees, we need to put up to that force. But most importantly, employers must do something towards promoting the well-being of employees. The third element, ladies and gentlemen, are the perspectives on how to address these challenges which have changed in line with the developments at the workplace. And of course, with the emerging evolution of knowledge, the wider socioeconomic and political factors. Another aspect in our conclusion, which we have already discussed, are the emerging issues such as the psychosocial factors, the increasing prevalence of non-communicable diseases, and the shift towards well-being. And when we talk about well-being, we are not talking about mere safety and health, no, but well-being. And all these demand new ways of thinking in addressing health, safety, and well-being in the workplace. And then, ladies and gentlemen, we have also been able to discuss how we can continue working in silos and adopting monodisciplinary perspectives, and how that creates a complex landscape that needs to be understood by the employers, employees, and other stakeholders. And we have also discussed a strategic alignment of perspectives and integrated approaches which are needed in managing occupational health and safety. Ladies and gentlemen, this course, as I said earlier on, aims to promote a way forward by outlining and critically evaluating developments in health, safety, and well-being in the workplace, and providing a framework for action in policy and practice. Remember, we are studying philosophical and, or what you call the philosophical foundations and the leadership of occupational health, safety, and well-being. You can actually rephrase and call it philosophy and leadership of occupational health and safety. Do not forget, our focus is on the philosophical dimensions, a description of reality, and applying a number of lenses, theoretical lenses, to explain what is happening at the workplace. And those lenses can be socially constructed, but there are also other lenses that can prove to be useful. Ladies and gentlemen, thanks very much for being attentive and attending this lecture, and we shall take off from there and go to our second topic in our course of the philosophy and leadership of occupational health and safety. Stay well, stay home, and stay safe. Good day.